Good afternoon. It is March 23rd, 2020, and this is the press conference for Johnson County for the day on the COVID-19 update. My name is Kelly Andreessen. I'm the Public Information Officer for Johnson County. Thank you to the members of the media for being here and for those watching on Facebook Live, and also want to thank our community partners for participating today. As I mentioned, today we are doing this as a Facebook Live on the Johnson County Public Health page. So for the reporters who are here, we do have a mic that Jack, our videographer, has. If you do have a question, please raise your hand, state your name and your credentials, and then ask your question so that it can be picked up on the audio. Today, the format will be, we have a number of presenters, and to honor social distancing, we will be bringing them in one at a time. They'll give their prepared statements, and then they will be available for question after their prepared statement, and we'll just do that one at a time down the line. If anybody has any follow-up questions after all of the speakers have presented, just let me know and we can get you connected with that individual person. Just also wanted to remind everybody, this is, as you know, a rapidly changing and fluid situation. So we're sharing with you today the most up-to-date information that we have, but I'm sure you all realize there's new information coming out all the time. So we're trying to share with you what we have right now. So today we have a few different speakers from Johnson County Public Health, Mercy, Iowa City, and the cities of Coralville, Iowa City, and North Liberty. And I will, at this point, hand it over to Dave Coach.
Thank you, Kelly. Thank you, everybody that is watching and listening in. Johnson County Public Health continues to work with Iowa Department of Public Health and a number of our local agencies to contain the spread of COVID-19 in our community. Currently, there are 35 confirmed positive cases in Johnson County. A status report of monitoring and testing of COVID-19 in Iowa is provided by IDPH and can be found on their website. In addition, individuals can call the hotline established for Iowans about COVID-19. That hotline is available 24/7, and you can use or dial 211 or 1-800-244-7431. IDPH is sharing a number of negative tests performed at the State Hygienic Lab and will begin to share the number of negative tests conducted at outside laboratories. Currently, the negative tests in Iowa stand at 1,215 negatives, and as I just said, 35 positives in Johnson County with 105 positives in Iowa. Sunday, Governor Reynolds recommended those who have traveled outside of Iowa, internationally or domestically, strongly consider self-isolating for 14 days. This will support Iowa's ongoing efforts to mitigate the spread of COVID-19 and limit the introduction of the virus from other points of travel. She also added tattoo, tanning, and salon establishments to the list of businesses that are to be closed through March 31st. Many leaders in our communities are coming together to contain the spread of this virus. We appreciate the mayors of the cities of Coralville, Iowa City, North Liberty, and Solon urging residents to stay home and limit non-essential activities. Limiting non-essential activities helps limit your exposure and exposure to others. COVID-19 symptoms can appear very mild and may cause people to think it's not important to stay home. I cannot stress this enough that even if you're mildly ill, stay home. You do not necessarily need a test. Everyone should consider that they may have COVID-19 and stay home if feeling ill. There is limited number of personal protective equipment like masks, the N95 masks you've been hearing about, face shields and gowns for healthcare providers and first responders. We need to conserve these resources by staying home. If you have symptoms, call your healthcare provider first. They will determine if you need to go to a provider for testing based on your risk assessment. Your provider will assess your age and any other underlying health conditions that you may have. We urge everyone to make the highest commitment to have absolute minimum in-person contact with others until notified otherwise. All of us share a great responsibility to protect our fellow residents, especially the most vulnerable people in our communities, and those who work and reside in healthcare and long-term care facilities. So I just want to stress again the importance of staying home if you're not feeling well, to continue to distance yourself physically from other individuals 6 feet, to monitor your symptoms, to call your healthcare provider before you show up at the clinic or the emergency department. These are things that all of us can do, and it's just very important, and I just want to reiterate that. So with that, I will take any questions that you may have.
Aaron Scheinblum from KCRG TV9. My only question could be sort of how do we know that all of these measures are working? We've seen a lot of calls for action as far as telling people to stay home. We've seen things across the county as far as different people telling us also similar things. Businesses closed down, stay home. How are we measuring success at a time like this, and how do we know those measures are working?
That's an excellent question. So over the weekend, we had several calls with local partners along with Iowa Department of Public Health. We also just had a call at noon today that just finished up, again, with our local providers. What we're really determining right now is the metrics on what we can measure. And there's about 18 metrics right now that we're discussing. We're going to have another call at noon tomorrow to be able to track the effectiveness of the prevention methods that we're putting into place. We're also wanting to develop thresholds for those metrics so that we can share sound scientific evidence with elected officials that are making these decisions. And we also want these metrics and thresholds to be consistent, not between maybe Johnson and Linn counties, but across the state. So the state is very involved in these conversations as well. It does take some time to put these metrics and thresholds together and all to agree upon those, and that's the process that we're working on right now. There's also significant difference between states and between large cities, and so we always can't take the data that's being generated out of cities like Los Angeles or Chicago with large transportation systems in place. So there is certainly a difference that we have to also look at. We're looking at various modeling systems that have been put in place from other communities and other countries. So there's a lot of that information, and we're utilizing the expertise that we have locally here at the University of Iowa and our hospital partners, as well as the university, along with the experts at Iowa Department of Public Health.
Can I follow up on that just real quick?
Sure.
You said that's going to take time as far as that metrics. Do you have a timetable as far as when you expect to kind of roll these plans out?
We were hoping to have that this afternoon. We will not have it this afternoon. Like I said, we're meeting again tomorrow at noon. And I can tell you that there's a lot of people that are working on this right now. And our goal is to have something at least preliminarily out tomorrow afternoon.
Thank you.
Absolutely.
Travis Breeze with KWWL. As we've gone in Johnson County from like 22 cases to 35, I think, over the weekend, maybe starting Friday, can you share, if you know, how many of those cases were because of community spread?
That's a good question, and I would have to defer that question specifically to our disease prevention specialist. We can get that information to you. I would hate to just project without knowing exactly how many of those cases through their investigations were due to community spread.
Michaela Ram from the Gazette. Do you know how many of those cases have been hospitalized?
So initially, total hospitalizations, and again, the hospitals will be able to confirm this, were 4 individuals, I believe. Currently, right now, we only have 1 individual that is hospitalized. Those others have been released. And a number of people, I also want to point out, a number of people on the original orders from the state for quarantine or isolation are also coming off those orders because it's been at the end of the 14 days.
Hillary Ojeda from the Press Citizen. How many people have been tested in Johnson County?
Total test count in Johnson County, I do not have that. We can get that information. The state's website does not break down the number of tests by county. They just provide the total number of negative tests at this point. I would have to get that information and bring that back at a future point, or we can try to get that information, get it out to the media.
Could you elaborate a little bit more on the non-essential movement outside of homes? So can people go outside and exercise? What's kind of the extent of that?
That's a great question. So the question was just on non-essential movement, and really we are still following the guidelines from Iowa Department of Public Health, and what's important to keep in mind is to keep that 6-foot distance, because that is really the perimeter that we have to maintain to really reduce any chances of contracting the virus. But certainly, we want people to still get outside, go to the parks, go for a walk. A lot of the management of this is also our own mental health, and so we want to make sure that people feel like they still can go outside, just to maintain that distancing. Certainly, if you have any symptoms, we would ask that you not go outside. If you have symptoms, we certainly want you to stay home. And if you need essentials, like food, for instance, there's other resources that we can either assist with, or if you have neighbors or family or friends that can assist with you in that as well. I think it's just really critically important to get across to the community that we all have a part in this, and we can all help slow down this spread by practicing really good physical distancing or social distancing from each other, and only go out when it's absolutely necessary. I know that's a big ask for our society and our community, but we can all help conserve the PPE that we've been talking about, the personal protective equipment. We can help the hospital systems. They only have, they have surge capacity and they can take a lot, but if we don't do our part as well, it's just going to make it more challenging for the other systems in our community.
Michaela from the Gazette. I had a follow-up question regarding PPE. Could you speak on whether the current supply of face masks, ventilators, things like that will meet the need for a projected surge? I don't know if public health is involved with those projections, but can the hospitals, do they have enough supply to take care of those patients?
That's an excellent question. I think when Dave Wilson comes in, that would be a question for him. He's really connected very well with the state and the supply chain and the resources available.
Great, thank you.
Hillary from the Press Citizen. On Friday, I think we said, or the public health department said 4 of the 22 cases had recovered at that time. Do you have an update on recovered cases?
You know, I don't right now, Hillary. I can get that information. I will check with our disease prevention specialist to get that number back to you, and we can include that in the release, in a follow-up release today.
Just another question on if someone is at home and they're feeling sick, can you explain a little bit more in depth on what you mean by mild symptoms, and just how communication should be with your doctor if you're feeling sick, because there are reports of people that unfortunately have passed at home. Could you be more specific about mild symptoms?
That's a great question. So mild symptoms, we talk about any type of, certainly if you have a temperature over 100.4, certainly if you have any of those influenza-like illness symptoms that we really experience every winter and hear about every winter. So the achy muscles, the fever, the cough, those types of things. Remember, 80% of the individuals that get COVID-19 will have very mild symptoms. I don't have the exact numbers, but out of the 20% then that may have to call their healthcare provider for an assessment and for further guidance, not all of those would need to be tested either. Again, it's so important to call the healthcare provider to have them do that risk assessment on you. It certainly has to do with your age. If you have other underlying health conditions, you may have a weakened immune system because of some medications that you are on. So I think it's just important for those at home with mild symptoms to understand what that means. We've all probably had head cold or influenza A or B over the course of our lives, and so these symptoms are the same. And so just understand that we don't have enough tests to test everybody that has symptoms. We certainly don't have enough PPE for everybody that has symptoms to go to the hospital to be checked face to face. So just keep those things in mind, and we'll all be able to help decrease the spread and to help our healthcare systems.
I don't know if, I guess this is a question for you, but how are public health officials in the university working to communicate with people coming back from spring break about the importance of self-isolation, and what are they required or being asked to do exactly?
That absolutely would be a better question for the University of Iowa. However, I can tell you that every day at our EOC right here in this building at our 3 o'clock call, the university officials are on that call as well. So we get an update on kind of the actions. I will tell you that what they have put into place is working very well. So what I mean, even outside of the students for their own populations, the report that I just heard this morning was around 5% of their total workforce is actually at work. The rest of them are working from home. And so even those recommendations are doing a great service to keep people home and to, again, practice that social distancing. I think if any employer can also look at implementing some type of work from home policy, it's going to help all of us. There's no mandate to do that, but voluntarily we're asking all individuals and businesses as well to really consider what you can do.
Mikhail from the Gazette, could you speak on whether testing capacity has ramped up here in Iowa, or at least in Johnson County, considering this is where the majority of the cases are?
It's a good question. Testing capacity has ramped up. I don't have the exact numbers, but I know the University of Iowa has ramped up their testing capabilities, and so has Mercy. There is still some limitations because of the swabs that are part of those test kits, and that's a common barrier across the country. And so everything that you're hearing on the news nationally and in other states, the challenges that they're having with getting enough test kits is also a challenge here for us locally. But the hospitals would be able to speak to that directly. Thank you so much. Appreciate it.
I'd now like to hand it over to Shaun Williams, President and CEO of Mercy Iowa City.
Thank you. I appreciate the opportunity to address you. At Mercy Iowa City, like at the university, the VA, and really every hospital in the country and certainly across the state, our focus is making sure that we are absolutely prepared for the predicted surge that may come through. One of the key areas that's very important to us is supply chain. Most of the cases that are being measured across the state or individuals that are being tested are obviously coming back negative. I think the last number I heard was around 90%. What we're trying to accomplish by reducing elective surgeries where appropriate, as well as any appointments that can be postponed, is to make sure that we conserve PPE, our personal protective equipment. The focus is obviously to contain community spread, but the biggest concern is conservation of resources, that if we're utilizing resources on healthy individuals, when and if that surge materializes, we're not going to be in as good a position as we might be if we're able to conserve that. One of the key areas we're trying to remind our staff and the community at large, as was just referenced earlier, is that most individuals, according to the CDC, that are diagnosed with COVID-19 will not need to come to the emergency room, will not need to be admitted. 80% of those will have what the CDC describes as a mild respiratory illness. That's very important because oftentimes individuals, when a disease like this is new, can be scary, can be intimidating. It's important for individuals to understand that the majority of people that contract COVID-19 will have mild respiratory symptoms. Of that 80%, a small or a relatively, it's fluctuating on the actual number, but a decent percent of those may not even know they have it, which of course can be dangerous if they're around those that are vulnerable. And that really is the key of my message, is that our focus at Mercy, and I know throughout the community, is that those individuals that are vulnerable either because of age or other underlying conditions absolutely need to make sure they're taking every possible precaution to not only keep themselves out of the potential of becoming infected, but all of those who care for them or provide support for them either in a healthcare setting or in the community need to make sure that we're taking extra precautions so that they remain safe. But that really is very much the focus. The population at large, I think, has gotten a lot of information that we need to help temper a bit in terms of what is the risk to them if they are a healthy individual. So the focus is making sure that, number one, that we conserve conserve resources so that when and if we have this potential surge, we are absolutely prepared, but also to our workforce and to the community at large, that frankly, people take a deep breath and understand this is a crisis that we will absolutely get through. The community is well positioned in partnership to do it, and that our concern or any activity that we take really needs to be focused on protecting those that are the most vulnerable. With that, I'd be glad to take any questions.
Hillary Ojeda from the Press Citizen. How many people has the hospital been able to test so far?
So at Mercy, we've tested about 66, and we've had 56 that have come back, 54 that have come back negative. So we've had 12 positives since this has started. Pulling up my notes to make sure I quote that correctly. Yeah.
How many people have, I know before we had talked with, I think it was Teresa who had said that there were 2 people, or there was 1 person still in the hospital at Mercy. How many people currently, is there an update on how many people are in the hospital?
I don't.
Also, Sarah Watson with the Daily Iowan.
Yeah, absolutely. So yesterday we discharged the last patient that we had that had COVID-19. So currently that patient is not at Mercy.
Michaela from the Gazette, could you speak more on your hospital's current supply of PPE and ventilators? At this rate, if there is a patient surge, how long would those supplies last?
Sure. Well, as I was describing to my children recently, if 1,000 people go to a restaurant for service all within 1 hour, it's a challenge. If it's spread out over a week, it's not. And that's very much the case within healthcare. We have about 18 ventilators that we currently have immediate access to, but within our system can access more if needed. The key for us is, one, is we've heard the phrase kind of wanting to make sure that we're flattening the curve so that these patients hopefully don't all surge at once. So from a PPE perspective, no matter how much any organization has, it's never enough. We're always trying to find more, either right now or access to more when and if the surge hits. But from a ventilator perspective, it's approximately 18 that we currently have access to. We've just recently opened a dedicated unit that initially, with private rooms, will be able to house about 28 COVID-19 patients specifically. That can go up if we need to double up individuals, but currently that's our plan, so that when and if that surge materializes, we'll be prepared.
And are those negative pressure rooms?
They are.
Travis Breeze with KWWL. I've seen some people still worried about the potential that somebody who's been discharged from a hospital could still infect other people. I wonder if you could dispel that, or talk a little bit about your guys' criteria for what a patient needs to look like before you release them from the hospital.
Well, I would certainly defer to a physician or disease prevention expert to answer that in more detail. But I can tell you from an administrative standpoint, the number one challenge we face right now is not the disease, it's the panic around it. Individuals, I get contacted frequently through work setting and frankly through personal settings where individuals will share that a loved one has contracted COVID-19. And in many cases, if it's a healthy individual without any underlying health concerns, as we said earlier, they're likely to have a mild respiratory illness, and in some cases, they may not know they have it. They're certainly a vector, and they can infect others, and they have to take every precaution. But that's the primary focus, is making sure that somebody that is a vulnerable health or a compromised immune system is kept safe from those individuals. Most individuals that go home and self-quarantine, they go through the incubation period and are fully able to re-enter normal life and really should be treated as such. So I think for me, the most important thing that can happen, because the more people are concerned or panicked, and in some cases almost a hysteria around the valid fear of COVID-19, those individuals are coming in for care. We're using testing supplies on those individuals. We're utilizing PPE that we may need in the future if we have a run. So my encouragement for individuals is to put it in perspective. If they have a compromised immune system, if they are a vulnerable population, perhaps due to age or other areas or other issues, they should be especially careful, and those that are interacting with them should be especially careful. But the general population and the concern and the panic is something that I think we need to do our best to try to help tamp down.
Michaela from the Gazette. I had another question about PPE. Is Mercy looking at increasing that supply in any way? I know some local hospitals have been putting a call out for donations.
Yep.
I didn't know if Mercy's doing the same thing or if you're looking at other methods to...
We are. We've been very creative. We have an incredible incident command team that's been in place now for almost 3 weeks, and with lots of creativity, both traditional avenues for supply chain as well as more atypical approaches, whether it be hardware stores, the different masks that are available, goggles that are available. We have a group of over 200 volunteers that have volunteered to help us make additional face shields as well as masks, some of which we may not use for patient care, but they absolutely can be used on potential COVID-19 patients. One of the most effective things you can do with a COVID-19 patient initially is if they are covered with a mask, then their ability to transmit that disease to someone else via droplets, et cetera, becomes reduced. So that's a focus. So we have volunteers as well as staff that are working really around the clock through more traditional supply chains, but also kind of thinking outside the box to make sure that we have ample protection for our staff. Thank you.
Sarah with the Daily Iowan again. I was just wondering, so you've been talking a lot about prevention methods, and obviously we all hope that these flatten the curve, but I'm wondering if you have a plan in place for if hospital workers are infected, or if that gets to a point where there would need, like, staff would start to become infected with.
Sure. We follow rigorously the CDC recommendations for that. So when we had one of the first several patients in Iowa and obviously here in Johnson County came through our emergency department. And as a precaution, any staff that had any interaction with those individuals went home and were on quarantine according to CDC guidelines. It's since been understood better in terms of when they are no longer symptomatic and they're past the incubation period. With a mask and other precautions, those individuals can come back safely to work. And we follow, and it's a changing target that the CDC is putting out for recommendations in IDPH as well. So we follow those exclusively. When they say a person is safe under certain circumstances, that's what we follow. But again, it's important. Most individuals, when they get past that incubation period, are going to recover fully, and they're no longer going to be able to transmit to others, and then they can safely return to a healthcare setting or elsewhere. Please.
Hillary Ojeda from the Press Citizen. Have any staff been tested for COVID-19?
Yes, and I don't know the exact numbers, but yes, we have had staff that have been tested.
Have any tested positive?
No, none have. Okay, thank you very much.
All right, next up is Mitch Gross, Mayor Pro Tem for the City of Coralville.
Good afternoon. Thank you, everybody, for coming. Thank you for the great coverage that you've had on this issue that our country and our world are facing. This is, in fact, a public health crisis, and because of that, it will take the entire public to stand up, step up, and to follow the directives of our public health officials as well as government officials. That's one of the reasons why the mayors of Iowa City, North Liberty, and Coralville yesterday came out with a statement urging people to limit all non-essential comings and goings as a way to keep flattening the curve of COVID-19. Many people have asked, what does that mean to limit non-essential comings and goings? Basically what that means is to only go out when necessary, to maintain 6-foot distances from other individuals at all times. Can you go outside? Yes, you can go outside. Can you exercise outside? Yes, you can exercise outside. But we are asking that you maintain 6 feet of distance during these times. And to be mindful during these times and to follow the instructions and the directives of government officials. From a Coralville standpoint, the city has, as all the other municipalities, have tried to be as proactive as possible dealing with this issue. We have stopped operations of certain departments. The Parks and Rec Department has ceased operations. The library has ceased operations. The Center for the Performing Arts has ceased operations. Other essential government services, city services such as water, sewer, transit, public safety, those are all operating as normal. For example, in our transit department, fares have been waived as a way to help citizens get to and from places they need to that time. Even though the library is closed, we have librarians on staff that are answering questions, that are bringing books curbside to people. We have an expansion of online resources, Overdrive, in which you can check out materials online, Canopy, our streaming services as well. So you only need a library card to do those. The parks are open. So again, as a time of high angst and anxiety, we encourage people to take some time for themselves to do what they can do to calm their fears, to calm their anxiety, go for a walk, go for a jog, enjoy nature as much as you can. So the other thing I would like to say, that we've had absolutely extraordinary collaboration amongst the various governmental entities within the county, the other municipalities, and the school district. Today, the Iowa City Community School District started a lunch program for any child in the area up to age 18. From 11 o'clock in the morning to 1 o'clock in the afternoon at City High, North Central Junior High, Northwest Junior High, Twain Elementary, Wood Elementary, Hills Elementary, and at the following mobile home parks, Breckenridge, Cole Thatcher, Lake Ridge, and Regency. Lunch is being served for any student, any child, and a brown paper bag for anybody who would like one. There are a couple caveats that are USDA required. The main one is that the children must be present to receive that lunch. So parents cannot just come pick up lunches for their kids. Children themselves need to be present for those lunches. But we are encouraging anybody who needs a meal, any child who needs a meal, to please come at those sites from 11 to 1. I'd be happy to take any questions.
Is that, I'm sorry, Travis Breeze with KWWL, is that lunch program, is that on ICCSD's website?
Yes, it is. Yeah, this is an ICCSD program that's been put together along with community collaboration.
That's it. Thank you.
Yep.
Sarah Watson with the Daily Iowan. Are you guys as mayors notified if somebody who's a resident of your town is tested positive for COVID-19?
No, those are obviously health issues, so that will go through the Johnson County Department of Public Health.
Michaela from the Gazette. Have there been any conversations with the Johnson County mayors about asking employers who haven't asked their employees to work from home, maybe having a conversation with them or implementing stricter policies about that?
And I think that's kind of on the part of the discussion about limiting non-essential activities. Obviously, being employed is essential, so that's where it gets to be a very slippery slope to making sure that we're maintaining social distance, but at the same time making sure that people have the means and necessities in order for them to carry on with their daily lives. But I think those are conversations that are happening throughout the business community. I think several businesses are slowing down or shutting down their current operations and are kind of adjusting to this new normal as we see it.
Could you give an update on when facilities are supposed to be closed until? Sorry, Hillary from the Press Citizen.
Yeah, and I don't have a hard date on when those facilities will be open. We're kind of waiting to see. We're also following directives. I think those of us in elective office at this point are relying upon the guidance of the Iowa Department of Public Health, the Johnson County Department of Public Health, our medical facilities, Mercy and UIHC for those kind of directives. Obviously, we're going to follow those instructions to make sure that we can flatten this curve as much as possible.
Are the Johnson County mayors having any kind of discussions about waiving parking transportation fees like Des Moines has?
Yeah, well, transit fares have been waived.
But like parking meters or like on-street parking?
Yeah, I'm not sure if those discussions have occurred or not. I think that's something that will be discussed in the future for sure. Great, thank you.
Next up, we will have Jeff Fruin, City Manager for the City of Iowa City.
Thank you, Kelly.
Yesterday, Iowa City Mayor Bruce Teague, along with Coralville Mayor John Lundell and North Liberty Mayor Terry Donahue, issued a joint statement urging residents to stay home and limit non-essential activities. They continued to stress the need for the public to remain calm and follow Governor Reynolds' orders and simple social distancing guidance that has been communicated by our public health leaders. The mayor stressed that by remaining calm and following these instructions, we can collectively make a significant difference and assist our frontline healthcare workers. The City of Iowa City has been taking steps to ensure that our critical services will continue to be provided to the community through the duration of this health crisis. These services include fire, police, water and sewer, refuse, and transit, among others. In the past weeks, steps have been taken to cross-train our city employees in many of these critical service areas. We have also adjusted work schedules, modified use of our facilities, and taken additional steps to limit essential employee interaction with employees and the public. We will continue to take all precautions that we can to ensure that the city will continue to provide these critical services and that our employees remain healthy and supported. Beginning tomorrow, all city employees that do not support essential services will be on work-from-home assignment and will not report to work unless urgent circumstances arise or there is a need to reassign them to a position that supports essential services. Many of these work-from-home assignments were initiated last week. I would like to end with a thank you to all those involved in the Johnson County Emergency Operations Center. The regional coordination and expertise provided have been tremendously helpful, and I'm extremely grateful for the long hours the team has put in here. The public should take comfort knowing that officials from all government organizations, cities, counties, schools, and others are working hard around the clock with our healthcare providers to respond as adeptly as possible to this health crisis. I would also like to thank our city employees who have been amazingly resilient through these past few weeks. Our employees have adapted to facility closures, suspension of services, new work schedules, revised work assignments, and have consistently been there anytime a new need or challenge has arisen. What we know is the situation will continue to change, and I'm grateful to be part of a team, both regional and at the City of Iowa City, that I'm confident can respond accordingly. I'm happy to answer questions.
Hi, Sarah Watson with the Daily Iowan. I was just reading a release that was sent out this morning that said city parking decks would be free of charge. So that includes like parking ramps, parking meters, on-street parking.
Yes, all the ramps are now free, so the gates are up and the public can access those. We pulled our cashiers out of those assignments today. There is still very limited enforcement of the meters in the core of the downtown area because we have, particularly in the loading zones, where businesses may still be getting deliveries or there may be curbside pickups going on. But again, that is really just limited enforcement as needed to keep those operations going.
Hillary Ojeda from the Press Citizen. Is there an update on, I know this is always changing, but is there an update on the dates that all of these facilities will be closed?
Yeah, when we announced the closures, we announced that they would be closed at least until April 5th. I think it's safe to say the closures will extend well beyond April 5th, but we have not officially extended that date yet.
Good afternoon, Jeff. Aaron Scheimblum, KCRG TV9. With the civil emergency in Iowa City, it gives you authority to purchase things without necessarily going to a bidding process for this emergency specifically. Have you done any of that yet? And if you have, what have we seen?
Yeah, the only purchase that would have probably required a different process is I authorized the use of city emergency housing dollars to help the overflow situation at the shelter house in Iowa City. So we identified, there's a team working on emergency housing, and that team identified some housing opportunities to alleviate some of the pressure that was happening at the shelter house.
Travis Breeze with KWWL. Have you had any conversations with some of the bigger companies in town that may be part of supply chains like Procter & Gamble that may have more than 10 people working on our factory floor at a time, something like that? Has the city been any kind of communication with them?
No, we have not had any outreach with Procter & Gamble or any other similar business like that.
Do you foresee a situation where that would happen?
No, I think if there's a need to contact a business with a supply chain issue, that's probably going to come out of the Emergency Operations Center here and some of the logistics operations here. We'd be happy to support. Certainly, if the healthcare providers needed us to step in and intervene, we'd be happy to do that. But we would take that guidance from the Emergency Operations Center.
I guess on any scale, have there been businesses that have been reaching out asking for guidance?
Yes, certainly we've had lots of questions from businesses, particularly after Governor Reynolds' first order that impacted restaurants and bars and fitness centers and those sorts of businesses, just on what would be allowed, what wouldn't be allowed. We've had a lot of businesses just wanting to make sure that they're doing the right thing, and that's been really satisfying for us to help them walk through that process. Our guidance has simply been, if you're going to remain open, for example, a restaurant, that you try to make sure that the social distancing practices can be practiced by the customers. So if that's spacing out your checkout lines or your pickup lines, doing more curbside, having a staff member out there to make sure that people are staying separate, we've offered that guidance, and businesses have been very great in seeking that guidance and implementing that.
There's only one other follow-up that I could have is because what makes Iowa City unique, obviously, is that civil emergency to the point where police can enforce it and make a citation or an arrest, even for something as like there's more than 10 people in a group. Has that happened, or how can people avoid that?
No, it has not happened, and I really don't think it will happen. Our priority of our police department is to get voluntary compliance. So if they do receive a complaint or they have seen a gathering, simply initiating contact, explaining, making sure the group knows what the order is, and explaining what they can do to alleviate the concern, and they're getting voluntary compliance. There frankly hasn't been that many concerns at all. I think the public is, by and large, adhering to those recommendations that have come out. So the police department will continue to seek voluntary compliance as much as they can. Okay, thank you.
All right, next up is Terry Donahue, Mayor of the City of North Liberty.
Good afternoon, one and all. Just want to give you an update as far as where the City of North Liberty is at this particular point in time. All of our city buildings are closed. However, our staff is working on tasks as far as deep cleaning is concerned, doing those projects that get put on the back burner and try to bring those items up to date. Our water plant, our wastewater plant is functioning fully. We have split shifts as far as ensuring that those services will continue. And our police and fire are certainly on site and ready to address anything that comes up. When we met with the Johnson County mayors this last Saturday, we had some very, very frank discussions about what is needed. The one thing that was right off the cuff was hospitals were saying, we need time. Also, they need support for their staff. Well, that blends itself into the precautions that are being asked of the public. We all agreed that the governor's orders will be done, distancing. Go ahead and make sure that you do your part as far as cleaning, sanitation is concerned, and just personal hygiene. Now, the thing that bothers me is that with so many people coming back from vacation, we may not know exactly what's going to happen. But we do know that we can ill afford any person to be haphazard, not really caring as far as what they're going to do. I think that is a unconscionable thing as far as how they're going to be around their friends, their neighbors, and just people in the community in general. We just don't know, because of what may occur, how far restrictions will have to go in the future. Certainly, if people adhere to them, we can stop the restrictions going higher than what they are. because all that does is raise panic in the community. Anytime that panic level is raised, it has impact on the hospital and the hospital staff. I do not want them placed in a situation where they're ultimately at the point where they have to say, I need to make a choice between home and family. They do not need that as a morale buster. The thing is that those resources have to be protected 100%. So please do your part wherever you can. Be mindful, be respectful. And it's not an issue. If we can get through it, we will get through it. Questions?
Good afternoon, Mayor. Aaron Scheinblum from KCRG TV9. You said a lot of the city buildings and city offices are closed, but business still as necessary. Law enforcement would clearly fall into that as necessary category. We have one of the smallest police departments in all of Johnson County, and I'm more interested in how do you ensure their safety during a time like this?
Chief Vinegar does a wonderful job as far as working with their staff on that and seeing that they have the needed protective equipment, know the rules of the ball game. When you stop a person, it is for absolute need. There's situations where, I hate to say it, but it may be better to let somebody go unless they're really doing something stupid. And that does happen from time to time. So I'm comfortable with the police in that fashion. Yes.
Hillary Ojeda from the Press Citizen. I've just kind of been checking with all the mayors or officials about when they think how long they think their facilities will stay shut based off of a changing situation and previous dates that were given. Do you have an update?
It is hard for me to hear. I've only got one good ear, so bear with me on that one, okay? Could you repeat a little louder?
Yeah, I could make it a lot shorter. How much longer do you think facilities will be closed? And I know this is based on everything that's happening, but do you have a date for when you're reevaluating how long facilities will be closed?
I tell you what is happening. Give you a date? No way. I'm not going to do that because they say, well, you thought this and it didn't happen. Now what are you going to do? No. The thing is, I know that Norfolk Liberty is being very careful is that we meet and have teleconferences with our department heads every morning during the work week. And so with that immediate input that we get from them, we can keep up, gauge where activities are going, what's happening, and make decisions on the run. Hopefully, a lot of this things can end, by midsummer. But as you hear other people say, we have no idea how long this is going to take.
Thank
you. Yes.
Hi, Michaela from the Gazette. You spoke a lot about the need to conserve supply and make sure that residents are complying with non-essential, or limit their non-essential trips outside of the home. Do you foresee any stricter policies or measures maybe enforcing that, such as maybe a county-wide shelter-in-place order?
If there is a county-wide order, we will abide by it. If the governor mandates it, we will abide by it. The thing is, our group does not want to restrict people any more than they have to be restricted as far as moving is concerned. The other side of the coin is we want our people just to use plain common sense. So that's where we're at on it. Thank you all very much.
Thank you.
We also have Board of Supervisors Chairperson Rod Sullivan. Though he does not have a prepared statement, he is available for questions if anyone has them.
Hey, everybody. Yes.
Hillary from the Press Citizen. What is the date right now that we are keeping facilities closed for as it is just today? Does that make sense? Sorry.
No. Can you repeat that somehow?
For some reason, I can't phrase this question. So facilities, city facilities have been closed. Some local governments have given a date. They're closed until April 5th. What is that date for you today for county facilities?
Honestly, I believe there was something in our resolution. I don't remember which date it was, but we're going to continue to evaluate that on a daily basis. It may not be a question, but I did want to add something if folks don't mind, and that's just, I want to reiterate the idea that we're just asking people to please be kind, be calm, and be patient. Everybody's doing the best they can. This is somewhat uncharted territory, and so kindness, being calm, being patient, I think will help everybody. Thank you.
Thanks, everyone. Thanks, everyone, for coming. Welcome to the Johnson County EOC briefing. First, I'd like to talk about just a few things. We've tried for 3 weeks now to provide a calm and reassuring voice to the public on what COVID-19 really looks like and what you need to do. Take good mitigation strategies to protect the health of others. And I think what we've seen is a great deal of compliance in that. And we'd like you to continue to advocate for that. As people return from vacation, spring break, whatever, we'd like them to continue to comply with those orders of the governor and those requests. Locally, we've had good support from our 3 hospitals. They've been really supportive of, getting us their needs for PPE, ventilators, et cetera. To date, we pushed out over 8,000 N95 masks. We pushed out a dozen impact vents to each of the 2 hospitals so that they've got increased surge capacity. We've seen good partnership with the care they provide the community, taking care of those people that did need to be hospitalized for a brief period of time. So I just ask that everybody continue to provide that calm, reassuring guidance to the public. And, we'll all get through this together. Like Mayor Donahue and others said, we're all in this together. The sun will come up tomorrow, and we all will get through this. I think it's scary because it's new. We try and reinforce to people that though it's a new disease, we understand how it's spread now better, and we understand more about it every day. And as we do, that should provide some reassurance to the public. So the best thing we can do in the media is to help reassure those people that are freaked out at home, to be honest with you, and to kind of try and drown out the people that are the naysayers and run around saying that everybody's going to die. That's not the case. Could we have fatalities from this? Sure, we could. But what we're trying to do is protect the community at large and the people that are most vulnerable. To that end, we've been having daily conference calls with long-term care centers for over a week now, making sure that they get their supplies, their PPE, that we know what's going on in those facilities. So we know if they've got an illness outbreak, what's going on there, what they're seeing, and how those patients are being cared for. And by being good partners and being socially responsible and trying not to share those germs that might carry on us, that's what the community can really do to help decrease the spread of this disease. The hospitals, the city public health, or the county public health, the cities of North Liberty, Coralville, the county, we've all been into this together. This isn't our first time. It's usually a flood or a natural disaster, but this is not our first time working together. And those strengthened partnerships are really what get us through all these things. And it's that close coordination, collaboration with everybody from the school districts to long-term care facilities to the pharmacy groups that's going to drive home the point that we are all in it together. We're all focused on the problem, and we're taking it seriously. And the thing we ask of the public is really try and respect those requests from public health, whether it's state, local, or et cetera. Try and honor those things so that we don't get those people most vulnerable sick. Additionally, I'd just point out, we've been pushing out supplies to first responders, nursing homes, and hospitals for well over 2 weeks now, trying to make sure that they've got anything that we've got in the way of shortfalls addressed. This morning alone, we pushed out 5,000 face shields, gave that source information to University Hospital so that they could get those face shields acquired for their people on the front line. And we're going to continue doing that. We were in a pretty good position going into this, to be honest with you. We started ramping up way back at H1N1. We had the H1N1 scare. We had the Ebola scare. Some people that were down here at that time are now working at Lynn County Public Health, and they helped us acquire some of those supplies. So a lot of those things that we've ramped up for in previous incidents, we've had on hand. So going into this, we were in a unique position. We had over 7,095 masks to push out. We had, 6 impact vents to push out right away. We've got 6 more that'll be in by the end of the week. So as we make sure those hospitals each have a dozen impact vents to augment their supply of critical needs, we couldn't have done that without the partnership of local government. If it wasn't for the County Board of Supervisors, the cities of Johnson County, everybody on the Emergency Management Commission supporting our program, we would not be as ready as we are. Unfortunately or fortunately, depending on how you look at it, Johnson County recovers well and we prepare well. Why? Because we have a lot of disasters here, right? And we all take the approach of we're going to get through this together. And that continues to this day. I think it's important for citizens to realize that we are all focused on the problem and we're going to do what we need to as a team, countywide, to get through this. With that, I'd entertain any questions, and sorry about my soapbox. Aaron, Hillary, go ahead, ma'am.
Hi. Could you go back to, could you repeat a little bit about what you mentioned on the number of face shields? And do you mean masks? And
No, they're different. So okay. University of Iowa on Friday, as you saw, put out a request for some face shields. They're kind of a more rigid face shield, almost like a welder's mask. It's clear in nature. And they've been looking at those since Friday. I believe it ran on some of the local news stories. We had trouble sourcing those. We spent a bunch of hours Friday on that. We were able to source that for them this morning, give it to University to go ahead and do the acquisition. So University is going to do the acquisition on that as opposed to it coming from us. Does that answer your question, ma'am?
Yeah, and the impact vents?
The impact vents are a surge vent that we used. I was a prior flight paramedic at area ambulance in Cedar Rapids, lifeguard. And so we use those a lot in the critical care environment. We used them when I was a federal responder as well. They're used for critical care transport of patients. They're very small, compact, and we've had a few of those on hand. We made sure that today there's 4 of those in each of the hospitals locally, and 8 of those in each of the hospitals locally, and by the end of the week they'll have 12. So by Saturday, we assure you that each of the hospitals will have 12 each of those impact vents, and they're used for surge. They're commonly used for critical care transport. Yes, Aaron, go ahead.
Dave, Aaron Scheinblum from KCRG TV9. I'm going to repeat a question that I started off with, but
Sure.
I think it's important to ask you too.
Yep.
At a time where there's a lot of uncertainty,
Sure.
how are we measuring success here in the county? And I'll ask you, how do we know those measures are working?
So I think a couple of the things that we use to measure success are how much we're seeing people anecdotally staying at home. And if you go through downtown Iowa, say it's pretty quiet. If you talk to Rod Leonard or anybody from the campus community, they've got hardly anybody working in their facilities. Most people are teleworking. You also measure that by the number of people that have been to the hospital. Right now, I think Shaun and the folks from the university said there's 1 in 1 hospital here in the community. We've had no deaths. I think that's a metric. Do we expect to see numbers climb? Sure, you bet. It's like the flu, and people criticize me for using that term. We use that term because it's something people can relate to. People understand the flu, right? So this is a virus, and it's transmitted in much the same mechanism. The droplets are heavier, and the contagion with it, is different. But we're trying to make it relatable to people. So as we see things like amount of people tested going up, do we think the number of people positive is going to go up? Absolutely. But how many of those people are recovering at home, not requiring admission to a hospital, not requiring an overrun of the hospital? That's kind of how we measure it, Aaron. We obviously want to see no fatalities, and we want to do everything we can to protect those most vulnerable, which we've identified as in nursing homes and those types of care facilities. So that's the metrics we use because there's not a good test base. It's not like the flu in many ways because we know what we're looking for. We've got testing capacity. With this, it's brand new. It's novel, right? So we're trying to use things we can measure. Hospital admissions, number of deaths, what's the volume of patients admitted. So we had a meeting today. We've got another meeting tomorrow. And as Dave Coach adequately explained, we're trying to define some of those things. But, if I said it was changing every hour, that would be an understatement. Sometimes it's changing every 30 minutes. So we're just trying to keep up. Does that answer your question fairly?
Thank you.
Okay.
Hi, Michaela from the Gazette. I was hoping you could speak more on the status of PPE supply at area hospitals. Based on projections of what a patient surge, if we do see a larger outbreak, do the hospitals have enough supply to care for that increased number of patients?
So I think that's a great question for the hospitals. I think they address that as best they can. We touch base with them every day. And right now what we're finding is based on today's load and where they're at this spot in time, they're good. The problem is we're anticipating, right? We're planners. And so we're planning for what happens when that spike hits, if it hits. Everybody talks about flattening the curve. That's what we're trying to do. We're trying to make sure that the hospitals are decompressed. They've, reduced elective surgeries. They've converted, areas to negative pressure. The hospitals have done some incredible things, not just in Johnson County, but in Lynn County as well. And so everybody's focused on what can we do to eliminate or reduce the curve? What can we do to keep the population healthy? And we know there's a supply chain issue, right? I mean, it's the same thing for swabs. We know there's a supply chain issue across the board. And it's impacted because of where some of this stuff's made. Let's be honest. Some of this stuff is not made right here in the USA. It is not readily available. So we're trying to address those, and we contact them every day, see where they're at. We literally every day, the logistics folks are driving stuff around. There's teams out right now dropping stuff at nursing homes and at hospitals. We've got a batch of equipment that I just walked by sitting in the hall that's going to University Hospital today. So can I guarantee you it's never going to happen? I'd be a liar. I can't say that. Well, what I can tell you is we're doing everything we can as a community and as a state to be prepared. Yes, sir.
Travis Breeze with KWWL. I think you talked about it a little bit, but I'm just wondering if you can specify, because 5,000 face shields sounds like a lot. I just want to make sure. Can you tell us where you got that many?
I'd rather not. I'd rather not disclose where we got them from. Just to be honest with you, we got them. We got them for the level 1 University Hospital. We gave them the source, and they're going to do the acquisition. But we're trying to make sure that the critical supplies and the critical needs get to the frontline healthcare workers. And if I go relaying that publicly, then it creates a stampede. It's much like you see on TV when they say, "Hey, the toilet paper's reloaded here," or whatever the commodity of the day is. It's immediately a rush on that. So trying to prevent that.
Yeah, can we classify it as a donation, or I'm not sure if I understand.
No, they'll have to purchase them.
Okay.
Yeah, they'll have to purchase them. Yep. Now, you brought up, Travis, though, about donations. We do have donations coming in routinely. We first talked about that, I think, last Tuesday in the press conference. Boy, wouldn't it be a good thing to do if your business is diverting patients and you're closed down, donate those PPEs. We got 2 or 3 contacts today from different companies. I don't even recall what they all were, wanting to donate supplies. And that has been happening routinely. So we are seeing a lot of donations as well. I'd encourage people to keep that up because as they're displaced, we can repurpose that. But this was an acquisition. Sorry, my voice gets a little hoarse. So you can imagine, I start talking about 7 a.m. and I don't shut up, unfortunately, till pretty late at night. Anyone else with questions? Yes, ma'am.
You had talked about the kind of defining the success of these measures is a hospitalization rate, and you had said, I just want to clarify, there's one person currently in a hospital here in this community.
Yeah, I believe Shaun from Mercy identified that they presently have no inpatients, and University pretty publicly announced a while back that they had one patient. And to my knowledge, at this spot in time, and it literally changes hour by hour, there's one patient in Johnson County. And there have been 0 fatalities. And the people that were the original cruisers, 6 of them came off isolation orders over the weekend. And the majority of the rest of those that are in Johnson County are at home in isolation. So, the portrayal that those people are all, 1 foot on a banana and 1 foot in the grave, it's not an accurate portrayal. It's just not. Could things change? Absolutely. We're in the business of trying to anticipate what's the worst case scenario. We plan for the worst, we hope for the best, but right now, spot in time, that's the reality we're dealing with. We've got 1 person in the hospital. The rest are convalescing at home. Most of those people that have been to the hospitals have been treated for symptomatic problems, dehydration, et cetera, and released and are back at home. I'd also mention a number of calls to 911. So we have not seen recently an uptick of that. You know, one of the challenges is the worried well, right? Everybody gets concerned about it. And so we did see a couple spikes where we were having an uptick in calls to 911. We know we have flagged in our CAD, our computer dispatch system, where those actual COVID positive patients are. So when a responder is going to one of those, we can pre-warn the responder so that they're not walking in blind. We've had only 4 calls since this started to those positively identified locations. We have an emergency medical dispatch card that is a screening tool that they use, and we track the number of isolation alert calls, which just means that they have something that makes them get in PPE. It might just be the regular flu. And so we're tracking all that data from the 911 center with our partners here at the Joint Communications Center, and we're making sure our responders don't walk into something blind. Does that help answer those questions? Okay. Anything else, Travis? Did you have something? Aaron? Hillary? Okay. All right. Well, thanks for coming, and we'll be back out Wednesday, I believe, Kelly, and then back Friday. And hopefully my voice will be a little more less shaky by then. Thanks.